Lecture 21 Chronic Diseases, Psychosis, page number 144 to 146.
It is not generally known that there are two kinds of gonorrhea. One that is essentially chronic, having no disposition to recovery, but continuing on indefinitely and involving the whole constitution in varying forms of symptoms, and one that is acute, having a tendency to recover after a few weeks or months. They are both contagious. There are also simple inflammations of the urethra attended with the discharges which are not contagious, and thus we have simple inflammations of the urethra and specific inflammations of the urethra, and of the specific we have two kinds I have mentioned, the chronic and acute. The books will treat of them as the one disease, treat them in a class, and in a treatise on gonorrhea we will have a description only of that which relates to the beginning, with the discharge. దాని గురించి ఉంటుంది కదా, ఇంకా తర్వాత ఉండదు కదా. The majority of the cases of gonorrhea are acute, that is, there is a period of prodrome, a period of progress, and a period of decline, being thus in accordance with the acute miasm. The acute may really and truly be called a gonorrhea because about all there is of it is this discharge. If the suppressive treatment be resorted to in the acute, the system is sufficiently vigorous in most cases to throw off the after effects. The suppression cannot bring on the constitutional symptoms called psychosis. It cannot be followed by figwords nor constitutional states such as anemia, but while constitutional symptoms cannot follow the suppression of the acute miasm, they will follow suppression of the chronic miasm and become very serious. Most of the cases of true psychosis that are brought before the physician at the present time are those that have been suppressed, and they are a dozen times more grievous than when in the primary stage. మన దగ్గరికి వచ్చేదన్నా సప్రెస్ అయిన తర్వాత ఏదో వచ్చేదా మోర్ డేంజరస్. In both the acute and chronic, the prodromal period is about the same, from 8 to 12 days. And there is no essential difference between the discharge of the acute and chronic. It is a mucopurulent discharge and may have all the appearances that any acute discharge of the urethra may take on. Any simple remedy conforms to the nature of the discharge itself will soon turn the acute miasm into a state of health, but it requires antipsychotic remedies that conform to the nature of psychosis to turn the constitutional psychotic gonorrhea into health. Psychotic gonorrhea. In the very earliest stage of the discharge, it is not necessary to make a distinction, but after the disease progresses for weeks, it becomes necessary to make a distinction and to follow the remedy that conformed to the more acute symptoms with the remedy that would be suitable in a psychotic constitution fully developed. Remedies are picked out for psychosis in the same way that the remedies are picked out in any miasmatic disease by making an analysis. Psychotic miasm లో మనం ట్రీట్మెంట్ ఇచ్చేప్పుడు కూడా మిగతా miasms లో అయితే మనం మొత్తం చేసిస్తాం, అదే ఆల్ దిస్ ఇచ్చేసి. An analysis of all the psychotic cases which we have had enables us to look at the constitutional state of psychosis just in the same way as Hahnemann, by an analysis of Sora, ascertained its nature and worked out the remedies that are similar in nature and action to Sora. All medicines that are capable of producing the image of psychosis may be called antipsychotics, but we can put it in this way also, and say all those remedies are antipsychotic, which when given to a psychotic case in its advanced state are able to turn the disease backward to reproduce the earlier form and bring back the discharge. That is the practical way of demonstrating that a medicine is an antipsychotic. When it conforms to the image of the miasm, it will turn the disease on its backward course. Those remedies that conform only to a particular part of the case are not deep enough nor similar enough to establish a return to earlier symptoms, and hence they are not truly antipsychotic. ఇచ్చిన కేసు ఏదో ఒక పర్టిక్యులర్ కేసుకు సిమిలర్ గా ఉన్న రెమెడీస్ అది యాంటీసైకోటిక్ రెమెడీస్ అవుతున్నాయి, పూర్తిగా ఇక్కడ ఆ రకమైనటువంటి యాక్షన్ ని అది ఎస్టాబ్లిష్ చేయలేవు. It is hardly necessary to go over a description of the acute form of gonorrhea, but let us turn our attention solely to psychosis, recognizing it as a chronic miasm or a disease whose first stage is a discharge from the urethra. These cases, I have said, are rare in proportion to the large number of cases of acute gonorrhea, but the disease seems to be on the increase. Every busy physician will see a good many cases in women and children. Cases of gonorrhea that have been suppressed by injections in the hands of old school are considered ended, and soon after the discharge has stopped, the psychotic patient may be told by his physician that he is a fit subject to marry as he has been cured. But it is not true, and he should delay marriage. It is not right for him to marry until the discharge has been brought back again and he has been cured not by injections because they only suppress, but by the indicated antipsychotic. Only then may he marry a healthy wife and she will continue healthy and bring forth healthy children. You will never know until you get in practice how common it is for a wife to break down in a year or 18 months after marriage with uterine troubles, with ovarian disease, with abdominal troubles, with all sorts of complaints peculiar to the woman, and you will then be surprised and going into the history of her husband if you are permitted to do so. To discover that in his earlier life he had 2 or 3 attacks of gonorrhea that were treated with nitrate of silver or by one of these prescriptions that are carried around in the vest pockets of the vicious young men by injections that are known to stop these discharges. You will not then be surprised if you learn that the man himself has never had a really genuine state of health since that gonorrheal discharge disappeared. You will look upon what followed the suppression in the man. You will observe what followed the contagion in the woman, and to observe these closely constitutes an interesting study. Sometimes it is very severe in form, and the trouble comes so soon after the suppression that there can be no doubt even in the mind of the man himself that the trouble he is now suffering from relates to the suppression of that discharge. Sometimes they are latent and develop very gradually, and the blood becomes affected, the gradually increasing anemia comes, the patient being pallid and waxy. What was said in relation to syphilis about contagion in the stage in which the individual has the disease is true in this disease as also in SORA. Here is a common instance. A psychotic patient has been cured as far as the discharge is concerned and now marries for he is told that no harm can come hereafter, but shortly afterwards his wife comes down with illness, whereas she had always been a healthy woman before. In the old school, there is no recognition of a gonorrheal condition, nor could the homeopathic physician be sure of this except for his careful prescribing. వారి పెళ్ళైన తర్వాత భార్య హెల్త్ పాడైందంటే వాడు మంచి గ్రంథస్థానం అయి ఉండాలి అనేవారు మాస్టర్. అంతవరకు శుభ్రంగా ఉన్నాడు, హెల్త్ కూడా పాడైందంటే పెళ్ళైన అప్పటి నుంచి అంటే వాడు మంచి గ్రంథస్థానుడు.